Hello everyone. Today we are going to talk about the skull, a complex structure strongly related to the locomotor system and to the nervous system. To begin the study of the skull, we must start from its function and from some basic anatomy notions. The function of the skull is to protect the encephalon, cranial nerves, and vascular structures. We can divide the skull into three anatomical areas: bony and sutural portion, formed by the cranial bones, the sutures, and the cranial foramina; the membranous portion, which includes the meninges, dura mater, arachnoid, and pia mater; and finally the liquid portion, arteries, venous sinuses, and cerebrospinal fluid. Let's begin with the bony plane. The skull is composed of two distinct regions, the Viscerocranium and the Neurocranium. The Viscerocranium is a collection of bones that make up the face skeleton. The Neurocranium is divided into bones of the vault and bones of the base. Today, we will make a list of the bones, with their topography, and in the next videos we will argue them, one by one. The Viscerocranium is made up of zygomatic bone, maxilla, lacrimal bone, nasal bone, ethmoid, vomer, palatine, inferior nasal conchus bones, and mandible. The Neurocranium is made up of parietal bone, frontal bone, sphenoid bone, temporal bone, and occipital bone. If we remove the cranial vault and look at the skull from above, we can see the bones that make up the skull base. The frontal bone, the ethmoid, which with its lamina cribrosa is the passage point of the olfactory nerve; the sphenoid bone with the sella turcica, where it houses the optic chiasm and the pituitary gland; the temporal bone site of the vestibulocochlear organ; the occipital bone, crossing point of the brainstem. We can divide the base into three areas: the anterior fossa, middle fossa, and posterior fossa. The characteristic feature of these fossa is their innervation. The anterior fossa is innervated by the first two branches of the trigeminal, 5-1 and 5-2, and contains the frontal lobe of the brain. It is bordered anteriorly by the frontal and posteriorly by the minor wings of the sphenoid. The middle fossa, which begins where the anterior fossa ends and terminates with the petrous part of the temporalis, is innervated by 5-2 and 5-3, thus always trigeminal nerve, and contains the temporal lobe of the brain. The posterior fossa is innervated by the entire trigeminal, the vagus nerve, and the cervical component of C3. It contains the occipital lobe, the cerebellum, and the brainstem. So the trigeminal is the actual nerve of the cranium. The sutures of the skull are fibrous joints that connect the bones of the skull. In a frontal view, we can see the medopic suture, also known as the frontal suture. It is a vertical fibrous joint that divides the two halves of the frontal bone and is present in the newborn. The glabella is the smooth midline bony prominence between the supraciliary arches of the frontal bone. Just below the glabella and between the eyes, where the frontal and the two nasal bones meet, there is a bony depression called nasion, also known as bridge of the nose. The frontonasal suture is the cranial suture between the frontal bone and the two nasal bones. This suture meets the internasal suture at the nasion. The frontomaxillary suture is the suture where the nasal process of frontal bone joins the frontal process of the maxilla. The nasomaxillary suture forms the fissure between the frontal process of maxilla and the lateral border of the nasal bone. The nasomaxillary sutures are parried. The frontozygomatic suture, also known as the zygomatico-frontal suture, is between the frontal process of the zygomatic bone and the zygomatic process of the frontal bone. The zygomatico-maxillary suture is between the zygomatic process of the maxilla and the maxillary process of the zygomatic bone. The intermaxillary suture is a cranial suture, just below the anterior nasal spine, between the right and left maxillary bones. At the superior end of the intermaxillary suture, there is the anterior nasal spine. The gonion is located at the most lateral portion of the angle of the mandible. The supraorbital foramen or notch is the small opening at the central edge of the superior orbital margin in the frontal bone, just below the superciliary arches, that transmits the supraorbital nerve, artery, and vein. The infraorbital foramen is located in the maxillary bone within the infraorbital groove. The infraorbital nerve gives off sensory branches to the maxillary sinus and upper teeth. The mental foramen is a small foramen located in the anterolateral region of the mandible, through which the mental nerve and vessels emerge. The mental nerve represents one of the terminal branches of the mandibular nerve and divides into 3 branches supplying the lower lip, cheeks, and chin. In a lateral view, we can see again the nasomaxillary suture, the frontomaxillary suture, the frontozygomatic suture, the zygomaticomaxillary suture, the anterior nasal spine, gonion, the supraorbital foramen, the infraorbital foramen, the mental foramen. The coronal suture is the cranial suture formed between the 2 parietal bones and the frontal bone. The sphinofrontal suture is a cranial suture where the frontal bone meets the sphenoid bilaterally. The sphenoparietal suture is the cranial suture between the sphenoid bone and the parietal bone bilaterally. The spheno-squamosal suture is a vertical cranial suture between the sphenoid and temporal bones bilaterally. The squamosal or squamous suture is the cranial suture between the temporal and parietal bones bilaterally. Pterion involves 4 cranial sutures: the sphenoparietal suture, the sphenofrontal suture, the coronal suture, the squamous suture. The sphenozygomatic suture is one of the paired cranial sutures formed by the junction of the sphenoid and zygomatic bones. Medially, it forms part of the lateral wall of the orbit. Laterally, it forms part of the anterior temporal fossa. The temporozygomatic suture, or zygomaticotemporal suture, is between the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. The parietomastoid suture represents the articulation between the parietal and temporal bones posteriorly. Anteriorly, they articulate at the squamosal suture. The parietotemporal suture is considered the most posterior continuation of squamosal suture. The occipitomastoid suture is the cranial suture between the occipital bone and the mastoid portion of the temporal bone. The lambdoid suture is the junction between the superior border of the squamous part of the occipital bone and the posterior borders of the right and left parietal bones. The Asterion is the junction on the side of the postero-inferior calvarium where 3 sutures meet: the parietomastoid suture, the occipitomastoid suture, the lambdoid suture. The external acoustic meatus is a bony canal for the ear canal, a tube running from the outer ear to the middle ear. From behind, the sagittal suture is the midline cranial suture between the 2 parietal bones, the lambdoid suture. The enion is the tip of the external occipital protuberance, the midline bony prominence in the occipital bone from which the ligamentum nuchae and trapezius muscle attach. Again, we can see Asterion. The Obelion refers to the skull landmark along the sagittal suture intersected by an imaginary line connecting the 2 parietal foramina. It is located on the sagittal suture 2.5 centimeters above lambda. Lambda is the midline bony landmark where the lambdoid sutures and sagittal suture meet, between the occipital and the 2 parietal bones. From above, again, the lambdoid suture, lambda, the sagittal suture, Obelion, and the coronal suture. The Bregma is the midline bony landmark where the coronal and sagittal sutures meet, between the frontal and 2 parietal bones. The vertex is at the most superior part of the skull, near the midpoint of the sagittal suture, between the Bregma and lambda. Going back to the skull base, we can see, anteriorly in the ethmoid bone, the cribriform plate, less commonly called the lamina cribrosa of the ethmoid bone, which allow the passage of the first cranial nerve, the olfactory nerve. In the sphenoid bone, the optic foramen, which is the opening to the optic canal. a canal that transmits the optic nerve and ophthalmic artery and its associated sympathetic fibers. The foramen rotondum is a circular hole in the sphenoid bone. It allows for the passage of the maxillary nerve 5-2, a branch of the trigeminal nerve. The foramen ovale is a hole in the posterior part of the sphenoid, posterolateral to the foramen rotondum. It is one of the larger of the several holes. It transmits the otic ganglion, the 5-3 mandibular nerve, a branch of the trigeminal nerve, the accessory meningeal artery, lesser petrosal nerve, and the emissary veins between the cavernous sinuses and pterygoid plexus. The foramen spinosum is a small hole in the greater wings of the sphenoid that gives passage to the middle meningeal artery and vein, and the meningeal branch of the mandibular nerve. Sometimes it passes through the foramen ovale instead. The superior orbital fissure is a foramen or cleft of the skull between the lesser and greater wings of the sphenoid bone. It gives passage to multiple structures, including the oculomotor nerve, the trochlear nerve, the ophthalmic nerve, the abducens nerve, the ophthalmic veins, and the sympathetic fibers from the cavernous plexus. In the temporal bone, the internal auditory meatus, also known as meatus acousticus internus, provides a passage through which the vestibulocochlear nerve, the facial nerve, and the labyrinthine artery can pass from inside the skull to structures of the inner ear and face. It also contains the vestibular ganglia. The intermediate nerve, or nerve of Risberg or glossopalatine nerve, is the part of the facial nerve. The jugular foramen, posterior foramen lacerum. It is formed by the temporal bone and the occipital bone. It allows many structures to pass, including the inferior petrosal sinus, the glossopharyngeal nerve, the vagus nerve, the accessory nerve, and the sigmoid sinus, becoming the internal jugular vein. From this view, we can see also the foramen lacerum, which is a triangular hole in the base of skull. It is located between three bones: sphenoid, the petrous part of temporal bone, and the basilar part of occipital bone. Greater petrosal and depetrosal nerves unite in foramen lacerum to form the Vidian nerve. The hypoglossal canal is a foramen in the occipital bone. It is hidden medially and superiorly to each occipital condyle. It transmits the hypoglossal nerve. The foramen magnum is a large, oval-shaped opening in the occipital bone where we can find medulla oblongata, vertebral arteries, anterior and posterior spinal arteries, meninges, spinal root of the accessory nerve, the tectorial membrane, and alar ligaments. From below we can see again the foramen ovale, the foramen spinosum, and the foramen lacerum, the foramen magnum, and the jugular foramen. In addition, we can see the carotid canal, which represents the passage of the internal carotid artery and its internal carotid nervus plexus. For today we have concluded. In the next lesson we will study the membranous portion of the skull. Hope it was helpful. Thanks for watching.